A report on healthcare in Karnataka 2023 has been released by an organization called Bahutva Karnataka, which looks at the performance of the state in the context of healthcare services. As per the report, Karnataka claims to provide comprehensive healthcare and effective measures to improve the health and much more at affordable prices. However, COVID pandemic threw up acute shortage of public facilities, exorbitant costs of poorly regulated private healthcare sector affecting both COVID and non-COVID patients. There's no disaster management plan in place, which includes a comprehensive, well functioning public health system and a well regulated private healthcare sector. Routing taxpayers' money to private providers through health insurance and public private partnership PPP neither improves access to healthcare nor is cost effective. Number clinics have been set up, but there are issues with timing, availability of human resources, lab equipment, drugs, etc. Promises made in the previous budget 2022-23 have not been implemented. The report suggests that ideally, existing urban health infrastructure could have been upgraded.
We are joined by Dr. Sylvia, who is the health expert and member of Bahutva Karnataka. And they have a health report on Government of Karnataka. Let's talk to her. Ma'am, first question is what made you to come up with this health report of BJP government?
See, there are some issues which are very important, which all of us as citizens and as taxpayers, we have to hold the government accountable. And the COVID pandemic, it's very hard to ignore the importance of the healthcare system. And that is why we feel that it is timely for us to comment on the healthcare system and give a report card on the performance. Basically, it's a way of holding the government accountable with our money, with our taxpayers' money, and with what are the duties of the government.
Is it good to target COVID because the India was not prepared when it comes to COVID?
See, that's a very important question because for any disaster, you have to be prepared in advance. We have to have a disaster management plan, and clearly we didn't have that. Some states had. Kerala, for example, had a very good plan. Karnataka did not have. We did not have a plan before the COVID pandemic. But even after we came to know about the pandemic, there were many things that we could have done to prevent the disease and also to treat it so that it doesn't become a serious crisis. But unfortunately, in Karnataka, what happened is we lost very crucial time because the government, the media, elected representatives were communalizing the pandemic. So they brought the issue of Tablighi Jamaat, which is not a scientific explanation because there are many pockets in a pandemic. What we see is in many areas there will be pockets. You pick one which is a Muslim pocket and then you make such a big issue. It had many adverse complications. For example, we lost time in preparing for the pandemic, but also it targeted the community, Muslim community, and there was economic effects on them. There were health effects. In many instances, they were denied health care, in certain areas. So these are all hugely problematic because people then start fearing the health system. People will not come forward because there is very important to give continuous messaging, to give positive, information which is scientific, which is reliable, and also to make people build trust within the system. So if you say that people are not trusting the system, then what you do is you start penalizing people. You punish people. You start, beating up people. Like we saw with migrant workers, what happened. It is a shame for the country, the way we handle both intrastate and interstate migrant workers.
Ma'am, since you spoke about Tablighi Jamaat, do you really believe or think that Tablighi was responsible for spreading the COVID because the way how it was portrayed?
No, absolutely not. As public health person, as doctors, we have studied epidemiology, and the way a pandemic spreads, it is completely unscientific and it is mischievous to target a community and say it is because of the Tablighi Jamaat. There were many gatherings of different religious groups and it is a lapse on part of the government. Just to give you a simple example, people who are coming, the disease came from outside. We have to remember that it's the international travelers who brought it into the country, and many of them are supposedly well educated and very nationalistic kind of people. they took paracetamol tablet before they did the fever check. So they showed the fever is not there. So the just it's a easy way of targeting one community to shift the focus from the government's lapses, and that is becoming a common thing for the government. That every time you start putting a spotlight on the government lapses, they will find some way of communalizing the issue.
And your report also mentions about the BJP MP Tejasvi Surya, where he created a big drama.
Yes. So during the peak of the pandemic, when the system was really struggling, in fact, in Bangalore, many of us were depending on volunteers, and I have to mention a lot of them are Muslim volunteers. We used to call them, in the middle of the night with crisis, saying we want oxygen, or some patient has died and there's no place to bury, or we need ambulance. There's so many issues that we had to call volunteers. And at that time, there was a war room, and this MP Tejasvi Surya went there, he barged in. So, first of all, just because you're elected representative, you cannot just walk in anywhere. There has to be certain protocols. He just went there with two of the MLAs, and they created a ruckus there. And out of a list of 200 odd people working there, he handpicked 17 Muslim employees, saying. And there was some bed allotment scam, and finally it was proved wrong. Finally he had no basis, but he got away with it. Why are we letting people to get away with such blatant discrimination? And instead of in the peak of the pandemic, trying to support, trying to make sure that the system which is struggling is supported by the MP, spreading positive messages, telling if your neighbor is alone, look out for your neighbor, make sure you give them food, water, basic supplies. If some migrant workers are struggling without rations, give them rations. Those are all very positive messages. People are not able to overcome those, their communal and caste mindset, which is very sad. And we as citizens, first of all, society has to do that, but we also have to hold our elected representatives accountable.
Ma'am, in your report card about health, related to health of Karnataka, from Bahutva, Karnataka, how many marks do you give to the present government?
We definitely fail the government. Basic infrastructure was not there, but during the pandemic, what could have been done also was not done. But even after the pandemic, a lot of things could have been done. For example, in Chamrajnagar, there was oxygen shortage and many people died. It is a huge tragedy. What lessons have we learned from that? And it was not only in Chamrajnagar. Many of us have lost loved ones, we've lost friends, lost our colleagues. We've seen how they have suffered. But has there been any effort made by the system to say these are all the issues, what have we learned, and how can we prevent it in future? There's nothing. There's no survey done. There's no effort to rebuild the system. So these are all huge lapses.
Ma'am, now elections are approaching. So what should people think in mind before they vote? Because you are giving a clear picture of the present government.
See, I think we have to go beyond caste and religion, the politics of that. And we have to look at development. We have to look at scientific approach. And we also have to look at a social justice approach. In any state, if one pocket is unhealthy, the whole city is unhealthy, the whole state is unhealthy. If a group of people are having malaria, the malaria is going to affect the entire state. So we cannot sit in small little our own bubbles and think that we are safe. Public health especially, we need the entire infrastructure. We need sanitation, we need good water supply, we need shelter, we need solid waste management. And for solid waste management, you need to pay the workers properly. You should give them dignity, because most of them are Dalit, men and women. So this is a form of casteism also, where you have a group of people who are giving you labor, but you're not paying them, you're abusing them. So as a society, I think we need to look at health beyond just hospitals. And definitely private hospitals are not a solution, because their agenda is only business, it's only profit. The more sick society is, the happier private hospitals are. But we don't want that. We want
Since you discussed about private hospitals, what do you think? What was the role of private hospitals when this pandemic issue was there?
So if someone can pay, they'll get treatment. And if someone cannot pay, they'll be rejected. But people who pay should remember that just because you pay, it doesn't mean you're getting good care. You might get unnecessary procedures and unnecessary treatment.
I just, as you mentioned just now, people who can pay, they go to private. People who don't pay, they have no option. But Government of Karnataka also introduced Namak clinics.
See, the Nama clinics, we again gave a bad grade to the Nama clinics because there is infrastructure, there are nice fancy buildings and they inaugurated the buildings, but healthcare is not only buildings. You need all the human resources. It's not only doctors. You need nurses, you need lab technicians, you need pharmacists, you need ambulance drivers, you need the cleaning staff, and you need facilities for them like lab reagents, you need drugs. There are essential drugs, and if those essential drugs are not there 24/7, then it's no use, that healthcare system. And it cannot be a standalone system. It has to have referrals. If someone is, an accident patient comes, they should have a referral to a blood bank. They should have referral to a tertiary facility. All those things were not really set up in the Nama clinics. People have complained about the timings. They've complained that some of them don't have basic staffing. Some of the staff have not received their salaries. And I told about the timings. But yeah, so sometimes the medicines are there just for 10 days and not all the medicines. So what people will do, they'll bypass the Nama clinic and they'll go somewhere else. In fact, we have many urban centers already. We have urban health centers. They could have been upgraded. And it has to be done in consultation with community. If you sit with people, ask them what are the timings you want, what are the facilities you want, what are the common diseases in your area. In some areas, they may need more of certain drugs, like maybe dog bites are more common somewhere, maybe allergies are common somewhere. So it has to be a thoughtful process. Just because you set up a building, it doesn't mean you're giving health care. And I think that is what we have to question. We have to own these healthcares. We have to go there, we have to ask, why is the doctor not there, why is the nurse not being paid, why is a group D worker being treated so badly, why are you abusing her. All those things is a part of owning. It's not a top down thing, but the community should own these healthcare facilities.
Thank you very much for talking to Ali Salama.